And Dr. Jen Ashton here helping us track all of the developments. A number of new cases reported in what's become a coronavirus hot zone, Jen, the White House.
Yeah, we're up to 20 cases and counting now, possibly looking at that Rose Garden as a super spreading event.
Well, in fact, let's take a look at some of the latest rising COVID numbers we're watching closely from Johns Hopkins University. There are now 35.8 million cases confirmed around the world, more than 7.5 million of those right here in the U.S., with more than 210,000 lives lost across America.
And Doc, we know so much attention has been on the president's health, how he's doing, how he's recovering, and also the treatment he's getting. He came out and said, I feel better than ever. Okay, take that with a grain of salt. But one of the treatments he got was steroids. We heard a little bit about this. Could that be contributing to him feeling better than ever?
Well, absolutely it could. And this was really the talk of the last 24 hours. So let's do a deep dive on the steroids and dexamethasone in particular. What we know right now, this is the only drug to have shown a survival benefit in clinical data in severe and critically ill COVID-19 patients. However, early data also suggests there is actually an increased risk of death when steroids are given to patients with mild disease. So this is not a one-size-fits-all treatment. It is a cheap, widely available drug. It's been around since the 1950s on the shelf of every hospital in the U.S. But you guys, like any medication, there can be side effects. In particular, a lot of people talking about the possibility of some severe psychiatric effects, emotional instability, euphoria, personality changes. These have been seen in about 5 to 6% of adults on this medication. But anyone who's ever been given steroids knows you do feel really good.
Right. And I also know, having had that treatment before, you can't stay on it for very long. So talk about some of the concerns that accompany steroid use.
Well, in terms of the risks, because it suppresses the immune system and then kind of targets that immune inflammatory response that can happen in COVID-19 patients, it can also increase the risk of infection. So again, it's about walking that fine line in terms of deciding to use it as a therapeutic and weighing the risks versus the benefits.
All right, Dr. Jen, thank you so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.